Hi, welcome to the second video for the Simplified Anatomy and Physiology for Athletes. My company name is People Biomechanics. In these videos, we describe a generic anatomical build with the basic design, reproductive design, and female pregnancy design. And these first 5 videos are as it regards just the basic design. Just kind of in review from the first video, we've got these kind of biomechanical words, always considered biomechanical parts. Sometimes they can be furthermore described as biomechanical tools or mechanisms. And then lastly, biomechanical organs. So of course we start with the list of parts. There's the 7 buckets for anatomical parts, in this case inner structure parts. And then we've got our functions list, always the same, and sometimes we describe them a little bit furthermore, but this is really the functions list. So that's your simple anatomy and physiology. All right, so very similarly, we're going to take these functions and we're basically going to move them through the template, and we're going to kind of add a contextual requirement for each of these columns. And then we'll check out the parts list, all those parts buckets with parts in them. And we'll be like, well, could this facilitate the foundational functionality? And then also there's going to be a contextual requirement for that column. All right, and lastly, we'll do this scaffold with the fittings and the fixtures. All right, so here's the flow of the presentation. And we'll do that for the inner structure parts. And we'll start with the parts buckets. So on here, I have the outer structure parts list and then the inner structure parts list. And for the inner structure parts, I usually indicate those with the circles as opposed to the squares, but I may have a typo or something in here, so don't worry about it too much, but that's usually how I do it. Integumentary parts, those are really sensory parts. And then because it's the basic design, we really just do non-reproductive orifices. And so really all that is that there's the female vagina is not going to be one of those parts. All right, so we've got our parts and then our functions. And here we go for the inner structure. And similarly, we, for the most part, really just care about those squares that have the gray shade in them. But we'll kind of run through the motions and put some other parts alongside the squares for a given column. All right, so again, how I group different material types. It's going to be solid, liquid, or gas. And for this first column, that's really all that we use is solid parts. All right, so we've got our list of parts, and then the functionality first and foremost is do any of these parts provide the functionality of packaging for the overall design? Well, yeah, definitely. And they also have to be solids. So very cool. So sensory parts, a lot of them can be thought of as being part of packaging, but they're really there for sensory design. And then, let's see here, orifices, they definitely are a part of the packaging. They really cinch the overall inner structure to the overall outer structure. So we'll go ahead and put that there. And then bone marrow actually cannot be included in this because it's a liquid. All right, so when we leave this, or when we bring this back to the template, we make sure we just have a part alongside it that has the little square that's shaded in gray. All right, so for packaging for an overall unit, for the inner structure that is also a solid, muscle is a great type of part. All right, so now we've got column 2. The contextual requirement is that it's a liquid. All right, so let's go ahead and look at that kind of foundational functionality. So the part needs to help with form for the overall design and also needs to be a liquid. All right, and it's kind of easy because it pretty much give the answers, but bone marrow would definitely facilitate those kind of requirements for functionality. And none of the other parts are liquid, so no worries whatsoever. All right, there we go, second column. So those parts together compose the inner structure of the musculoskeleton. All right, so column 3. The context is really delivering nutrients into the systematic unit, and a lot of it's handing off nutrients to the circulation system, which is kind of the next column, but it's really group 4, but either way, I digress. It's more so transferring nutrients and then taking out the trash. So it's a little different than the first presentation, column 3. Is that one is more so about bringing in materials to an overall unit and excreting materials from an overall unit. So there we are with column 3. All right, so we've got plumbing as the foundational functionality. It's kind of vague, but it's all right. And then the contextual functionality for that column is going to be delivering nutrients and picking up waste. All right, so the tongue and the stomach definitely help with that. And waste would really just be for like volume of blood balance kind of thing. So getting rid of liquids. So not so much waste, but just material transfer. And then lungs help to deliver oxygen to the heart, and then help to excrete CO2. It's kind of like the venting for the circulatory system. So all right, those definitely are applicable. And now we'll go ahead and clean up any parts that may not be associated with that gray one. And we'll go back to the template. All right, column 4. The context here is more so receiving nutrients and delivering waste back to system 5. So the gray box that we really just worked with was system 5, and this is system 4. So this is getting nutrients from system 5, and then circulating those nutrients, and then delivering waste back to system 5 to either, to mostly, get rid of the liquid blood volume balance is quite important. And we'll touch on the thermodynamics as far as, sorry, I just threw out an engineering word. We'll touch on that in the 13th video. But it just looks at kind of a systematic view for most practical purposes for a generic anatomical build. Definitely sticking with just the basic design. All right, so we'll go ahead and we'll look at this. And so now it's pretty similar to the functionality of the previous column, but just kind of knowing that it's like system 5 handing off nutrients, and then system 4 taking those nutrients, circulating them, and then system 4 bringing back the trash to system 5 to excrete it from the overall unit. All right, very cool. So looking at the parts here, heart and lungs, okay, that's an easy one. I kind of gave the answers here, so that's all right. And then as far as receiving nutrients and delivering waste, those all definitely kind of help. The tongue can absorb nutrients just on its own, so it's pretty cool. All right, so let's go ahead and clean up those other parts before we go back to the template. All right, so back at the template here, and we're going to go to column 5, and we're going to touch on the context. And the context is sensory design. And then we'll go back also to the foundational functionality for that group. And so we have, the part needs to help with modulation along with being a part of the sensory design. Okay, very cool. So integumentary parts definitely help with modulation. Some take in sensation and some give off sensation. So, all right, integumentary parts, that works. And then we've got the brain, which definitely helps with modulation and also helps with sensory design. All right, so we'll go ahead and clean up the parts that aren't alongside the gray box. And there we go. All right, so we've completed the template here for the inner structure parts. And now we'll go ahead and do the scaffold parts. So we'll do the anatomical regions and then the fittings and the fixtures. So there are the anatomical regions. And we'll go to the scaffold here. and we'll hang with the generalized regions. And here are the instructions. This is just touching on the instructions from the first presentation. And we're going to add to that fittings and fixtures. And when we go through this, mostly it will be a phrase, and it may be, so it's regions, and then it's fittings, which in this case are going to be orifices, and non-reproductive ones, and then fixtures. So a lot of times words, similar words are used to describe a region as they are to describe an orifice, not so much orifice, but as, orifice, and as they're also used to describe sensory part. So as I go through this, a lot of times I'll be like, this region, this hole, this sensory part. It sounds kind of funny, but it really helps to keep it straight. All right, so we've got the outer structure core region. And here are the non-reproductive orifices. And really what they're doing is they're connecting the overall inner structure to the overall outer structure. And orifices classically are described as a hole in someone's musculoskeleton to allow for material movement in and or out of an overall unit. That's kind of your classic definition for an orifice. The way I have it organized here is that I have orifices here that may not classically be referred to as orifices, but it works pretty well with how I describe it and the tools I have to use to describe it as well. So your classic orifices are going to be like your nose, holes, and then your mouth, urethra, and anus for sure are classic orifices. All right, so when we go through this for the overall anatomical build, there's only so many places to put fittings. So we really just go through with kind of the ones that make the most sense. So for orifices, your nose holes and your mouth hole, and then urethra, and then anus. And then for integumentary parts, and these are sensory parts, the way I define it in this Simplified Anatomy and Physiology, the function is to cap off the overall inner structure with the overall outer structure. And these are the types of sensory parts that I have. In this little diagram on the left, it's kind of a small font, but it's pretty cool. I have 7 integumentary parts, and then I associate them with a given type of sensation or types of sensation alongside the direction of that sensation. So not to dwell on it here, but it's kind of cool. All right, and as we go through this, these are all direct sensations, sight, smell, auditory, that can be in or out, taste, and there's placeholders here, and then there's touch, which is also a direct sensation type. These placeholders, there are sensations that I have in the organization, but they basically combine the sensations in, and it puts together another sensation. So Great example would be smell and taste, and then those together would be flavor. All right, very cool. So we'll go ahead and we'll put kind of like the most important fixtures for this overall generic anatomical build. So for sensory stuff, really you're gonna have eyes and ears as kind of the most important of them. And then for like the arms and the torso region, really from those parts, the only ones that are there for sensory inwards is gonna be hair, so armpit hair. And then for sensory inwards as well, obviously, pubic hair. All right, so back to this slide. And the only types of sensation parts or integumentary parts are going to be tongue, teeth, and nails for sensory outwards design. All right, so for the overall anatomical build, we've got tongue for auditory out. We've got teeth for, like, you could say tactile out or force transferred out, but basically outwards touch. And then you've got nails, similarly for outwards touch. And then toenails also for outwards touch. So there's not as many sensory parts that are associated with outward sensation. And if ever you look up, like a physiology book, or you just look it up online, integumentary parts or sensory parts, they are grouped very differently in different types of physiology books. And this is just really how I have them organized within these videos. All right, so for head scaffold, we're gonna do the same thing. We're gonna take those head regions and we're gonna add fittings and we're gonna add fixtures. All right, so we've got non-reproductive orifices. So there's 6 in here, and it makes room for later on having the female vagina as an orifice part for the reproductive design. So we'll go ahead here, add the orifices, and there shouldn't be any holes in someone's forehead. And then you've got eye holes, nose holes, ear holes, and mouth hole. And there shouldn't be any holes in someone's chin region. And now we'll go ahead and do this first for sensory input, sensory parts, and then sensory output, sensory parts. So for the female design, this is pretty cool. It's we've got hair, eyebrows, eyes, nose, ears, and tongue. And that is it. Now for the male design, for sensory inwards, there's room on that scaffold for chin hair or a mustache or a beard, but it would be in the general region 3, so the mouth and the chin region. All right, so for sensory outwards design, these scaffolds do look the same. And remember, there's only 3 types of sensation parts for that we use here for sensory outwards design. And those 3 parts are going to be tongue, teeth, and then nails. Shouldn't be any nails on a head scaffold. And so we've got tongue and teeth. And it's for both genders. Awesome. So we have gone through the vast majority of the presentation. Now I do have an optional 2-page worksheet. The first one is really going through and putting those parts alongside, in the template, and then doing the scaffold for the overall anatomical build and adding fittings and fixtures. And you can fill it out if you like. Now this is pretty fun. If you'd like, you can go through and practice saying this out loud. For instance, you can go through, and I'll do the brain one here for modulation, and say the brain provides the function of modulation for the overall unit. And so that's pretty fun and should be simple enough and kind of enjoyable. And that's it. So kind of where we are right now is that we've gone through and we've got all the parts for the basic design. We've kind of talked about functionality, definitely as regards outer structure. We've touched on that. We've done a lot of running through the motions, which is totally cool. And then we've touched on functionality a little bit more as it regards the inner structure design, kind of namely the orifices, how their functionality is to really connect the overall inner design with the overall outer structure design. And then the sensory parts are really to connect the overall inner design with the overall inner design with the overall outer design, but as it regards sensory design, not so much plumbing or circulation. Thank you so very much. The next presentation, we kind of hang with the tools we've touched on so far, and we start doing athletic diagrams. Thank you.